मृत्युनाशं धातारमीशं विविधौषधीनां चव्योमवातावनिवारिवन्निं पञ्चप्रपञ्चात्मकदेहभाजन् सन्तापसम्पातजराज्वरान्तकं नमामि धन्वन्तरिमादिदेवम् नवीननीलं मुदकान्तिकान्तं शान्तं हरेद्वादशमाख्यमूर्तिं पूर्तिं शतानां सुमनोरथानां नमामि धन्वन्तरिमादिदेवं नमामि धन्वन्तरिमादिदेवं नमामि धन्वन्तरिमादिदेवम्। धन्यवाद। भगवान धन्वंतरि की कृपा हम सभी पर सदैव बनी रहे तथा यह ज्ञान यज्ञ सफलतापूर्वक संपन्न हो, यही प्रार्थना। आज के इस विशेष सत्र के उद्घाटक के रूप में आदरणीय डॉक्टर रविंद्र शिवदास पाटवदकर सर की गरिमामयी उपस्थिति हम सभी के लिए अत्यंत हर्ष एवं गौरव का विषय है। हम उनके प्रति हृदय से कृतज्ञता व्यक्त करते हैं कि उन्होंने अपने बहुमूल्य समय से इस कार्यक्रम की शोभा बढ़ाई। अब मैं आदरणीय डॉक्टर रविंद्र शिवदास पाटवदकर सर जी का संक्षिप्त परिचय प्रस्तुत करना चाहूंगी। डॉक्टर पाटवदकर सर जी ने एमडी पैथोलॉजी की उपाधि प्राप्त की है तथा पिछले लगभग 30 वर्षों तक डॉक्टर हेडगेवार रुग्णालय संभाजीनगर में पैथोलॉजी विभाग प्रमुख के रूप में उल्लेखनीय सेवाएं प्रदान की है। वर्तमान में आप श्री रामचंद्र मेडिकल इंस्टीट्यूट ऑफ साइंस संभाजीनगर में एसोसिएट प्रोफेसर के रूप में कार्यरत है। पिछले 4 वर्षों से आप all the participants kindly mute your microphone। पिछले 4 वर्षों से आप आरोग्य भारती देवगिरी प्रांत के उपाध्यक्ष के रूप में सतत कार्यरत है। सर, आपका व्यक्तित्व, ज्ञान, अनुभव, सेवा भाव एवं संगठन क्षमता का ये प्रेरणादायी संगम है। आज के इस कार्यक्रम में आपकी उपस्थिति हम सभी के लिए अत्यंत प्रेरणास्पद है। अब मैं आदरणीय डॉक्टर रविंद्र शिवदास पाटवदकर सर जी से विनम्र अनुरोध करती हूँ कि वे अपने प्रेरणादायी विचारों से हमें मार्गदर्शन करें।
Namaskar and good evening. I will be speaking in English for the sake of respected Dr. Dinesh ji. Firstly, congratulations to Arogya Bharati Paschim Kshetra for organizing this national level online lecture series Ayurveda Abhyasanam. And this is the 34th lecture. As we all know, for acquiring the knowledge and skills, we have to read, repeat and revise. We have to repeatedly go through the topic. Slowly, we start understanding it, go deeper into it, and then apply the knowledge. After applying, start diagnosing that particular disease, go on adding similar patients to our experiences, treat them, modify the treatment suitable to the patient. Now we have to share these experiences to others. Also, we have to get updated, newer researches. This way, we share knowledge, we share variations in the same disease to others. It is said that knowledge enhances by sharing. In Marathi, it is also said that शहाणे करून सोडावे सकळ जन, meaning make others knowledgeable, and not only to the common man but also enriching the knowledge of all of us and our fraternity. So I hope this lecture series will add to your knowledge and enrich. This lecture series is a laudable effort from Arogya Bharati and needs appreciation. I wish best wishes to Arogya Bharati and this lecture series and all of the participants, and express my gratitude towards Arogya Bharati and also Dr. Dinesh ji for the upcoming lectures. Thank you so much. Namaste.
थैंक यू सर। आपके अमूल्य मार्गदर्शन एवं प्रेरणादायी उद्बोधन हेतु हृदयपूर्वक धन्यवाद। आज के इस कार्यक्रम में आपकी उपस्थिति हम सभी के लिए अत्यंत प्रेरणादायी है। अब हम आज के मुख्य व्याख्यान की ओर अग्रसर होते हैं। आज के हमारे माननीय वक्ता है डॉक्टर दिनेश के एस सर जी। Sir is currently working as Professor and HOD, Department of Kaumarbhritya, Vaidyaratnam PS Varrier Ayurved College, Kottakkal, Kerala। डॉक्टर दिनेश के एस सर जी कालीकत यूनिवर्सिटी से गोल्ड मेडलिस्ट है तथा आयुर्वेद चिकित्सा, शिक्षण एवं अनुसंधान क्षेत्र में एक प्रतिष्ठित नाम है। उन्हें आयुर्वेद एवं इंटीग्रेटिव हेल्थ साइंसेस के क्षेत्र में 2 दशकों से अधिक का व्यापक अनुभव प्राप्त है। वे CIMCD, IUCALM तथा अतिथि जैसे अभिनव संस्थानों के संस्थापक हैं, जो विशेष रूप से डेवलपमेंटल डिसऑर्डर्स एवं डिफरेंशियल डिसेबिलिटीज वाले बच्चों को समन्वित चिकित्सा एवं देखभाल हेतु कार्यरत है। उन्हें 23 वर्षों का क्लिनिकल अनुभव, 20 वर्षों का अध्यापन अनुभव एवं 8 वर्षों का शोध रिसर्च अनुभव तथा 6 वर्षों का पब्लिक हेल्थ स्पेशलिस्ट के रूप में अनुभव प्राप्त है। उनके उल्लेखनीय कार्यों के लिए उन्हें वैद्यश्री अवार्ड, डॉक्टर यल्ला प्रगदा सुब्बा रो मेमोरियल अवार्ड 2024, NABH फेलोशिप फॉर बेस्ट रिसर्च तथा यूरोपियन एकेडमी ऑफ आयुर्वेदा जर्मनी द्वारा सम्मानित किया जा चुका है। वे केरला यूनिवर्सिटी ऑफ हेल्थ साइंसेस में PhD गाइड के रूप में भी कार्यरत है तथा अनेक राष्ट्रीय एवं अंतर्राष्ट्रीय व्यावसायिक संस्थानों से भी जुड़े हैं। उन्होंने 24 शोध पत्र प्रकाशित किए हैं तथा विश्व भर में 300 से अधिक व्याख्यान दिए हैं। बाल रोग, कैंसर एवं वंध्यत्व चिकित्सा ये उनके प्रमुख क्लिनिकल विषय है तथा ह्यूमन माइक्रोबायोम उनके शोध का विशेष क्षेत्र है। आज वे हम सभी के समक्ष अत्यंत महत्वपूर्ण विषय डेवलपमेंटल डिसऑर्डर्स पर अपना मार्गदर्शन प्रदान करेंगे। सर, हम सभी आपकी वाणी से प्राप्त करने हेतु उत्सुक है। मैं आपसे विनम्र अनुरोध करती हूँ कि कृपया आप अपना व्याख्यान प्रारंभ करें।
Very good evening, one and all. Are these slides visible?
Yes, sir.
Is it in the presentation mode?
Yes, sir. It is visible in PPT mode now.
Respected galaxy of Ayurveda experts, pardon me because this Arogya Bharati, I got all of a sudden one mail that those who wish to take the classes that can register, it was plain mail. I usually not responding to such mails, but today, not today, on that day, I searched about the Arogya Bharati because it was not known to me previously. So I came to know that they are doing a lot of wonderful works for the propagation of Ayurveda. So I thought that it was a busy day for me today, but still, and all the cancellation of my online consultation. This is my online consultation time, and decided to come here. My point is actually I was not that much familiar with this organization, and there was no guidelines for the presentation. So I have prepared in another way. I thought that it is a short presentation. Later on, I came to know that it is time given is much more span of time is given. But I'm going to present only certain points regarding the developmental disorders. By taking the spirit of Arogya Bharati, I wish to give you certain glimpses from the common BIMS doctor point of view, not in the Kaumarbhritya point of view, because developmental disorder is a little complex subject. That is the reason why, because majority of the Ayurveda people are hesitant to take developmental disorder for their clinical practice. Of course, there are certain Kaumarbhritya practitioners, they are doing such practice in developmental disorders. This is my personal website regarding my activities. Currently, I am working with a government-aided Ayurveda college in Kerala, Kottakkal. This website has been developed just to interrogate with the people all around the world, to ask their questions regarding Ayurveda, to communicate with me regarding the questions regarding the Ayurveda. So, the developmental disorders, the Ayurveda treatment options that I will tell you, not in detail about the developmental disorders. Simply, the developmental disorder means a child after birth, he or she is developing like neck holding is achieving, sitting is achieving, crawling is achieving, walking at the same time, the thought process, vision, and behavior, speech, everything is developing. In the maturation of the nervous system, all the developments are coming out of the myelination of the nervous system. In the due course of the time of this myelination process, if any problem occurs, either before birth or at the time of birth or immediately after birth, if any problem occurs to the maturation process of the nervous system, that will result into either a major or a very minute developmental disability or developmental disorder. It may be a total, the child will be total a bedridden condition, or it may be as minute as simply the child not able to pick up certain letters. L is always confusing. That is also a developmental disorder. Or D and B is confusing. That is also a developmental disorder. So it can be from the very simple to a higher complex presentation. Current situation analysis, that is what I want to give you, especially the BIMS doctors, complementary and for everything from common cold to complex chronic medical conditions. So the people all around the world, they are searching for some alternatives in almost all the disease except certain acute life-threatening condition. Of course, whenever they are getting a heart attack, nobody will search for an alternative. Everybody will be rushed into the modern hospital and they will get proper life-saving remedies. But immediately after discharge, they will search for alternatives. Similarly, for every disease, except the 15% of the global life threat, that's only 15%. In the human, among the human being or the human mankind, only 15% conditions are connected to life-threatening situations. Rest of the 85% conditions, globally the people are searching for alternatives. Because in majority of the countries, doctors, hospitals and medicines are the cause of third or fourth cause of disease or death. So my point is, complementary and alternative medicine is now for everything from common cold to complex chronic medical conditions. Moreover, Ayurveda is an accepted complementary and alternative medicine by WHO. So the factors studied regarding the developmental disorder so far by different researchers, not only in India, not only in Ayurveda, globally, several studies had been carried out. What are the factors connected to the developmental disorder and complementary and alternative medicine? Number one is ethnicity. Regionally, in India, it may be Ayurveda, and in some other area, it may be something other than that. So regionally, there are several ethnic culture or practice which is connected to this developmental disorder. Associated medical conditions connected to the developmental disorder are a thrust area for complementary and alternative medicine. And the CAM like Ayurveda is very powerful to reduce parental stress. And presently, whatever the studies are showing, outcome hope mismatch. Parents are having lot of hope that alternative medicine everywhere. If you are going to the modern, if you are going to the physiotherapy, if you are going to the speech therapy, if you are going to any of the therapies, the parental hope is much bigger than what exactly want to have. So outcome and hope, there are mismatches. There are match and mismatch between the expense and outcome. How much the parents are spending for developmental disorders, how much outcome is coming, there are mismatch between these. And hello, I am audible now? Dr. Divya, I am audible now. Then lack of understanding of the disabilities among the parents. Among the parents, they don't know what exactly to do with a developmental disorder. These are the usual studies came out by different researchers. This is the hope of Ayurveda. This is the scope of Ayurveda. And outcome hope mismatch can be minimized along with the management team for developmental disorders. Expense outcome can be appropriated by using Ayurveda, and Vijnanam Oshadinam Sreshtam, according to Charaka Samhita. So make them aware, make the parent aware about the condition, and Ayurveda people are very well concentrating upon the education of the parents regarding the treatment, what they are doing, and what are the therapeutic outcomes that we can expect, what are the problems presently presented by the child that can be educated very well. Inner, which happened in India especially, there are several types of complementary and alternative medicine therapies are available for autism, cerebral palsy, and other intellectual developmental disorders and developmental problems. Vitamins, minerals, and use. There are some herbal and non-vitamin supplements. Combination of herb and pills. These are the different type of complementary and alternative therapies which are prevalent nowadays. In Ayurveda, especially in Kottakkal, we have 3 types of protocols, mainly for almost all the developmental disorders. Agastya protocol, Ayurveda drug, gut therapy, Ayurveda standards of living, training of the parents, and yoga assistants. Agastya for autism spectrum disorders we are doing. Ayukam for learning disability and autism, and Kottakkal protocol for cerebral palsy. Now Agastya is expanding in several areas in different countries. Near about 12, 13 countries are conducting different workshops in Agastya among the parents as well as the healthcare providers. And in India, there are now the 24th Agastya workshop is going to happen in the next month in Bangalore, in SDM Ayurveda College, Bangalore. Usually for Ayurveda doctors, it will take 2 days of time for the hands-on workshop to study the properly. After the workshop, after 2 days, they will start to treat the autism children. That is two days of hands-on workshop. The Kottakkal protocol for the cerebral palsy is well established in many areas of Kerala. And mainly the diseases what we are treating under the developmental disorders are Down syndrome, intellectual developmental disability, previously it was known as mental retardation, multiple congenital anomalies, degenerative neurological diseases like spinal muscular atrophy, hereditary spastic paraparesis, such conditions, muscular dystrophies, epilepsies, and others. This is in addition to the autism and learning disability and cerebral palsy. Autism, learning disability, and cerebral palsy. In addition to that, these are the main conditions what we are managing. Out of which the workshop is available only for the autism, because autism is nowadays fast growing disease. Now in developed countries, it is 1 among 35, 37. So this is mainly the Agastya protocol for autism. And we took a general opinion from the parental survey. From 321 parents, we took a survey. They are from one family, one parent included in this survey who have completed last 1 year of management in one of our institute, SIMCD, Center for Integrative Management of Children with Differential Abilities, where all integrated management facilities are available along with Ayurveda. All therapies are available in my department. My department is the biggest department here because including the SIMCD, we have 24 faculties. So my point is, we took a survey among the parents, and that survey was funded by International Federation for Ayurveda, and here one Kerala government agency is there, Kerala Ayurveda Studies and Research Society. Usually we saw these are the different diagnoses which are coming for the Ayurveda treatments. As I mentioned you earlier, ADHD, communication disorder, IDD, Down syndrome, disruptive behavior disorder, learning disabilities, hearing loss, miscellaneous, and there are certain percentage, they are only for came for consultation. Among the survey, treatment taken, among those parents, treatment taken, Ayurveda treatment taken, around 42% of the families took Ayurveda, not all. This center is consisting of several other therapies like
हेलो।
therapy, behavior therapy, physiotherapy. So there are many people are coming on, not for Ayurveda. You are audible? We asked them, those who are continuing Ayurveda, we asked them one question: why continuing Ayurveda? Why continuing Ayurveda? 80% people, they made an open opinion that lot of improvement. And 38.9% people told that this is due to Dr. Dinesh told, or the team of Kaumarbhritya told that is why. And a mild percentage of the people are, if at all any benefits are coming, let them come. These were the opinion. Why opted Ayurveda? Here also there are wonderful opinions among the parents. No side effects. Other treatments are ineffective. That may be subjective variation. But they are telling other treatments are ineffective. And 54% of the people are opining Ayurveda will have good, effective outcome. That's right. Current projects, but we are continuing in developmental disorders. Public health initiative project is there by government of Department of Ayush, by government of India. RCT is going on in our department by government of India. That is, this is the real project what we are continuing right now. Any people or any organization, those who are coming from any states, they can avail this Agastya protocol, Ayurveda drugs, gut therapy, Ayurveda standards of living. They can study Ayurveda management in autism. This is another RCT regarding the Abhyanga and Tailapichu in children with cerebral palsy. So such several studies are going on. Even if you teach the parents, regarding do's and don'ts in Ayurveda, by looking at the Ayurveda principle, by looking at the Ahara Niyama, among the autistic children, they will improve. That's also one study happened program. Number one is, in Ayurveda drugs, we are mainly concentrating upon Vishahara Chikitsa and metabolic corrections, especially in case of autism. Why Vishahara Chikitsa? Many heavy metals, not only heavy metals, but lot of other Visha implications are connected to the autism-like conditions, and many developmental disorders during the embryogenesis. Maternal toxicity is one among the several reasons. And we are concentrating upon the metabolic corrections, Agni Chikitsa. Metabolic corrections means simply the Agni Chikitsa. In Agni Chikitsa, especially in autism, it is purely concentrating upon the Kosta. That is why gut therapy protocol. If you are doing the Kosta Chikitsa successfully, 50% of the autism symptoms will come down. For example, autism can be presented in two ways: with Pitta symptoms, without Pitta symptoms. All the autistic children are having Koshtagata Agnimandya. So with Pitta symptoms has to be treated with Tiktarasa Pradhana Deepana Pachana like Rajanyadi Churnam or Pachana Amritam Kashaya. With Pitta symptoms, should be treated with Tiktarasa Pradhana Trivyas like Rajanyadi Churnam and Pachana Amritam Kashaya. And without Pitta symptoms, like there is no hyper, there is no recurrent fever, there is no stomatitis, There is no recurrent otitis media. All those are without pitta symptoms. There you can have Ushna Tishna drugs like Hinguvashtaka Churna or Hinguvajati Churna or Panchakolam Kvata for Deepana Pachana therapy. My point is, without considering the Agadi Chikitsa, majority of the developmental disorders will not give you results. Simply by prescribing directly the Kalyanaka Grida or Brahmi Grida or Saraswata Grida, that may not give you results. Gut management is mainly concentrating upon establishing good bacteria, relieves the constipation, especially in case of epilepsy and spastic quadriplegia cases. Constipation is the real villain. Constipation is the real culprit to aggravate the disease, not to get the desired results. By telling constipation is a very simple thing, but to treat constipation is very difficult. Pediatric is not a choice for constipation treatment. But constipation management should be pakkajanam. Marodasma vartma arsatra prishta katigraham karotyadarakayeshu chatamstan kutsranubhan. And karotyadarakayeshu chatamstan kutsranubhadravan. Very important point in case of spastic diplegia. In case of myoclonic jerk, Akshapakavadavyadi, in case of several focal epilepsy, see the main culprit is Pakvashekadavayu. In Akshapakavadavyadi, in Apatantra, in Amadanaga, it's a Samrati is going on like this. Adhapratihado vayur vrajanurdam hridasrayaha nadi pravishya hridayam shirasangauchapidayan. Akshibel paridogam danurvachasya namayet. So adhapratihada vayu means under stuck vayu. The only vayu which can be stuck beneath or under the lower part of the body is apana vayu. If you are not treating apana vayu, constipation improves digestion, manage. Wonderful results are getting to autism. But why B12 deficiency is happening? Their gut is not functioning properly. So give Dipana Pachana properly by looking at the Pitta dosha. These deficiencies will be managed permanently. There is no need of any injection. So there is no need of any temporary relief. Permanent relief can be achieved. These are the one of the results for your academic interest, what I am telling. This is from one of my work. We have analyzed the microbiome of the total gut microbiome of the autistic children. And before treatment, the bad bacteria like Escherichia coli reduced very well. And the bifidobacterium like bacteria are regularizing. These are the top 10 genus across the different samples. This is the relative abundance, what we call relative abundance in microbiology, in bioinformatics, means how much abundant microbiome is there. See, the bifidobacterium is the powerful bacterium which are needed for us. And all those are relatively abundant. Top 10 phylum. The brain management, how we are doing? We are giving whatever the Vadavyadi treatment you are doing, like Sneha, Sweda, Udvartanam, Abhyangam, Yogavasti, and Matravasti, whatever it may be, all these are finally resulting into good quality neuronal plasticity in the brain. Good quality neuronal plasticity in the brain. Neuronal plasticity means neurons are like plastic. You can mold according to your wish. You can mold a child's neuron because they are too young. You can mold the child's neuron according to your wish by giving a lot of our Ayurveda treatments. So all these are finally resulting into neuronal plasticity, activate lot of unutilized brain in a better way. Unutilized neuron. What does it mean? Even the Sir Isaac Newton has not used more than 10% of his brain before his death. So that much percentage of the brain area is not properly recruited for different functions. And different brain neurotransmitters are coming into equilibrium. Spasticity management. In case of cerebral palsy, for example, tight leg or tight limb, upper limb and lower limb are too tight. Very successful management is available if they are doing physiotherapy along with Ayurveda. Reduction of tightness is a hectic process. So far, the modern medical world is concerned. They are doing botulinum injection, botulinum tablets, Bontox tablet. They are doing surgery. Instead, if you are doing Sirasna, you get the Vata Kapha treatments. Successful management of spasticity is available. This is one among such graph. This is here. This SW group are given with physiotherapy and Ayurveda. GW group are not given with physiotherapy, only Ayurveda. See how much reduction from this to this, from this to this, almost both are same. So my point is, only in Ayurveda group itself, wonderful results are getting for the tone of the muscles. Hyperactivity management, very powerful in Ayurveda. Very powerful in Ayurveda, hyperactivity management. Because it is a product of social, body, family and brain. Here comes the Data, Satyaparaha, Chamavan, Aptobasevi, Vishayeshwa Saktaha. These are the different points what we are adapting in our adaptive behavior modification management. Even with the help of psychologists, we are doing it. Acharya Rasayanas. Yoga, family yoga, highly in learning disability, intellectual developmental disorder, previously called as MR, and autism spectrum disorder. Somebody asked a question that what is autism, sir? Autism means it is a condition in which language problem, no socialization, the child will will not look upon you, and there is always involuntary actions or interest. That is autism spectrum disorder. So highly yielding, yoga is highly yielding. I have actually, I became the instrumental for the establishment of a firm, network firm in Kerala, which is called as Aditi. Ayurveda people will get a franchise out of it. Several my students have started Aditi branches in different areas of Kerala. We are giving unconditional support to train the Ayurveda doctors to start the Aditi and everything. Aditi means Ayurveda Therapeutic Integration for Developmental Habilitative Intervention. All these conditions management we are teaching. My point is that all Aditi branches, they are wonderfully doing yoga in autistic children. Starting with family yoga, later on turning to individual yoga. Parental training programs are very important in all developmental disorders. We need to teach the parents regarding how to do Pichu, how to do Pratimarsanasya, how to do simple Avagaha. And we are giving courses to the parents, both online and offline. Offline course is available, but actually which is not enabled for Indian parents. Many of the foreign country parents, like the countries like Russia, they are not getting proper visa to come to India. There are several struggles. So almost a majority of my clients are from such countries like African countries and Russia like countries. They are availing parental training program for developmental disorders and autism through online courses. And Aditi people are conducting this online course. I am not conducting directly because it involves money matter and everything. Okay. These are in-house online training programs for the parents, what we did. Several parents will be taught with the several procedures of Ayurveda. What are the usual outcomes if you are doing proper Ayurveda in developmental disorders? Appreciable reduction in the spasticity in 6 months of time. Hyperactivity reduces in 3 months of times. Along with individual education program, in learning disability, class performance increases in 1 academic year. Attention increases in 3 months. Socialization increases within 3 months. Gut function improves within 1 month. If it is not achievable within this span of time, either the parents are not Bishak Vashya, otherwise the Bishak is not a Samarthya. These are the two conclusions. Okay. Daksha Tirthartha Syastartha Drishta Karma Shujir Bishak. Dakshaha is very important point. Either the physician is or the doctor is not capable, otherwise the parent is not Bishak Vashya. How can we analyze whether the progress is scientific or not? There is no, should not be present as magical or superhuman or mystical type. Ayurveda is not like that. Should not be an occult or trade secret. Everybody can study Ayurveda management, how it can be. Simply, if you are putting an email to my principal's email, gather 50 doctors and take our TADA, we will come and teach you for free of cost. So, my point is, it is not an occult one. It is not a hiding one. For workshop, maximum 50 doctors will be accommodated. More than that, it is not possible because it is hands-on training. There should be some autistic children. Only then it will be possible. And my eligibility criteria to attend my workshop is the Ayurveda doctor should take a video in front of an autistic child. By seeing him, he should explain the clinical features of that autistic child. Only then that doctor will be eligible for my workshop. Because without seeing an autism case, I cannot enroll them in my workshop. It should not be highly economy oriented. It is not an expensive one. Autism management should not be an expensive one. And there should be scientific explanation in terms of dysbiosis, in terms of neurotransmitter, in terms of nervous system. It should be easily accessible. There are several FAQs related to Ayurveda programs in developmental disorders. Whether the Kottakkal premises are necessary for all this purpose? No. Everywhere it can be practiced. It's simple one for Ayurveda doctors. This is Aditi. Aditi is for developmental habilitative intervention. Anybody can take one Aditi franchise. You just log in www.aditi.in and you can take the franchise. You can apply for the franchise. But there are certain conditions they are putting. Whether the children will cooperate with the treatment, it's the usual thing. Hyperactive children, MR children, whether they will cooperate or not. Obviously, they will cooperate. Within 1 week, they will be calm and they will start to take all the treatments. Whether it is expensive, it can make us expensive, but actually speaking, this is not expensive. In expensive setup, in elite class, in elegant setup, you can make it expensive, but actually speaking, it is not expensive. Any side effects? Usual question. If there is effect, there is a side effect if it is not properly used. Whether severe patya is needed, patya is needed, is a usual question from the parents and several other doctors. Patya and apatya is not for the medicine, but for the disease condition. Whether Ayurveda and allopathy will go simultaneously? Yes, mostly. In case of seizure disorder, especially. In autism, there is no allopathic medicine. In cerebral palsy, sometimes black coffin medicine pediatricians are prescribing, we are not stopping it. In epilepsy cases, we are not stopping it. We will give both simultaneous. Certain procedure-based therapies what I am using for this condition are as follows. Avagaham. We are giving avagaham for the diplegia cases with dashamulam. Such a type of avagaham is very effective. And also this is a sensory integration therapy for autism. This is very powerful in case of spastic diplegia. Pradimarsanasya. We are giving Pradimarsanasya in case of cerebral palsy, in case of learning disability, in case of mental retardation, in case of autism. Shashtiga Annalabam, in Malayalam it is called as Navaratepu. This is powerful procedure in cerebral palsy, in autism spectrum disorders, in learning disability, and in case of muscular dystrophy, in case of spinal muscular atrophy. All these are very well managed with Shashtiga Annalabanam. Orofacial massage or Mukhalabam. Mukhalabam or orofacial massage. This is Saraswata Churnam or otherwise called as Kalyanavalaha Churnam. This can be mixed in honey and daily this will be massaged through the oral cavity, and this is very powerful in speech development, in autism spectrum disorders, and this is also stimulatory technique for cerebral palsy, and this is very useful in case of spectrum disorders. All you know Takradhara and Shirodhara. Takradhara is the most powerful treatment for developmental disorders rather than Shirodhara, Taila Shirodhara. Takradhara, in case of Kapha dominant cases, we are using Dashamulam Satyasthapanakam. In Pitta dominant cases, we are using Panjagandhan Churnam. These are the different types of Takradhara what we are using. Very successful in ADHD management, in autism management, cerebral palsy management, learning disability management, ID management. Udvartanam, rather than Abhyangam, Udvartanam gives powerful results in case of cerebral palsy, in case of autism. Abhyangam is more powerful in case of cerebral palsy. This is Ubanaha with Vimlabana Dravya. In Ayurveda, Vimlabana Dravyas are mentioned not in Susruta Samhita but in Ashtanga Sangraha. Vimlabana procedure is mentioned in everywhere, but Dravyas are mentioned in Ashtanga Sangraha. Take those Dravyas to manage the very powerful, very good for management of spasticity, and this is the Ubaraha which are in the Arkapatra. By this, I am winding up because I have one more program. in 8:30. I can delay it up to 8:35 only. So give me quick questions that I will manage to answer you for the next 5 minutes of the time. If
Yes.
anybody of you got idea whatever I have presented, if you got it in the right spot, if you don't understand it, that may be due to the problem of Dr. Dinesh KS. Forgive me. By this, I am winding up. And thank you, our organization and the elders and the seniors and Guruji like fellows. And because this is new to me, anyway, once again, the kudos to your effort, because only by seeing the effort of Arogya Bharati, I took initiative for this. Please continue. And thank you for this opportunity. Thank you very much. How can we do speech
Thank you, sir.
therapy? We are not supposed to do speech therapy, brother. That is just the question. Speech therapy should be done by speech therapist, but you should do Ayurveda along with the speech therapy so that speech outcome will come double effect. Yes, Dr. Divya, please proceed.
Yes, sir. Thank you. You have wonderfully covered all aspects of Samhita Siddhanta, practice, research aspects related to developmental disorders, sir, with good video presentation and graphical presentation. आपका ये लेक्चर अत्यंत ज्ञानवर्धक, विचार प्रेरक एवं क्लिनिकल दृष्टि से अत्यंत उपयोगी रहा. आपने विषय को अत्यंत सरल एवं प्रभावी शैली से प्रस्तुत किया. आदरणीय वक्ता महोदय का विशेष आभार. अब हम कार्यक्रम के समापन सत्र की ओर बढ़ रहे हैं. यह हम सभी का सौभाग्य है कि आज के इस राष्ट्रीय स्तर के व्याख्यानमाला कार्यक्रम के समारोह हेतु में आरोग्य भारती पश्चिम महाराष्ट्र प्रांत के आदरणीय वैद्य संतोष जी कटने सर जी का सानिध्य एवं मार्गदर्शन हमें प्राप्त हो रहा है. अब हम आदरणीय वैद्य संतोष जी कटने सर जी का संक्षिप्त परिचय प्रस्तुत करना चाहूंगी. आदरणीय वैद्य संतोष जी गटने सर जी आरोग्य भारती पश्चिम महाराष्ट्र प्रांत के सचिव के रूप में निरंतर आयुर्वेद एवं भारतीय स्वास्थ्य परंपरा प्रचार प्रसार हेतु समर्पित भाव से कार्यरत है. आप महाराष्ट्र आरोग्य विज्ञान विद्यापीठ नासिक के सीनेट सदस्य भी है तथा स्थायी समिति सदस्य के रूप में भी महत्वपूर्ण दायित्वों का सफलतापूर्वक निर्वहन कर रहे हैं. इसके अतिरिक्त आप एक अनुभवी आयुर्वेद चिकित्सक एवं आयुर्वेद औषध निर्माता के रूप में समाज सेवा तथा आयुर्वेद चिकित्सा क्षेत्र में उल्लेखनीय योगदान दे रहे हैं. आदरणीय घटने सर जी से मैं विनम्र निवेदन करती हूँ कि वे अपने समारोह एवं प्रेरणादायी मार्गदर्शक विचारों द्वारा हम सभी का मार्गदर्शन करें. आदरणीय वैद्य संतोष जी घटने सर जी.
सभी को नमस्कार. आदरणीय डॉक्टर दिनेश जी, आरोग्य भारती के राष्ट्रीय स्वास्थ्य चिंतन आयाम के प्रांत के प्रमुख, अध्यापक श्रेणी के प्रमुख और विद्यार्थी आयाम के समन्वयक का काम करने वाले डॉक्टर मनोज चौधरी, इस आयुर्वेदाभ्यसनम के सारे कोऑर्डिनेशन टीम के मेंबर्स जैसे कि डॉक्टर दिव्या पाटिल, डॉक्टर देवदत्त देशमुख, डॉक्टर राहुल गौड़ी, आज के इस सत्र के उद्घाटक डॉक्टर रविंद्र पाटवतकर जो कि कोषाध्यक्ष है देवगिरी प्रांत के, और अन्य सारे कोऑर्डिनेटर की टीम और भागीरथी मेडिकल फाउंडेशन के सारे सदस्यगण. डेवलपमेंटल डिसऑर्डर्स इस महत्वपूर्ण विषय पर आज हम सब वैद्यकीय प्रोफेशन में, व्यवसाय में काम करने वाले सारे चिकित्सकों के लिए या आरोग्य के क्षेत्र को चैलेंज है ऐसा कह सकते हैं. ऐसे विषय पर आज के वक्ता ने बहुत ही अच्छा हम सबको मार्गदर्शन किया है. आरोग्य के जो भी विषय है और इसमें जो भी समस्याएं है ये सारी समस्याओं के विषयों में काम करना, यह आरोग्य भारती का काम है। स्थानिक कार्यकर्ताओं की अपनी अपनी क्षमता अनुसार, उपलब्ध कार्यकर्ताओं की संख्या और उपलब्ध समय के अनुसार सारे कार्यकर्ता काम करते रहते हैं। आज का जो विषय था उसके बारे में ट्रीटमेंट के स्वरूप में आयुर्वेद के सारे चिकित्सक अच्छे तरीके से ऐसे रोगों को ट्रीटमेंट दे रहे हैं। जो सुझाव डॉक्टर दिनेश जी ने हम सबको दिया है, जो सबके लिए प्रशिक्षण के स्वरूप में वो देने के लिए तैयार है, तो उस पर विचार आरोग्य भारती की पश्चिम महाराष्ट्र की टीम अवश्य करेगी। इसके साथ ही आरोग्य भारती और भागीरथी मेडिकल फाउंडेशन की द्वारा आयोजित इस आयुर्वेदाभ्यसनम की व्याख्यान श्रृंखला में इसी विषय पर और भी व्याख्यान होने चाहिए, ऐसा आज का व्याख्यान सुनने के बाद मुझे लगता है। तो डॉक्टर दिनेश जी को और सारे आयोजकों की ओर से एक विनती है कि विषय तो बहुत ही अच्छा रखा गया, लेकिन ऐसा हुआ है कि और भूख बढ़ गई है सुनने की। इसलिए यह विनती करते करते हुए कि इस विषय को और आगे बढ़ाते हुए इस विषय पर और भी व्याख्यान दिए जाए, जो सारे वैद्यों के लिए और वैद्य बनने वाले सारे विद्यार्थियों के लिए अत्यंत आवश्यक है। और इसी के साथ यह डेवलपमेंट डिसऑर्डर्स हो नहीं, इनको प्रिवेंट करे, इसलिए आरोग्य भारती का जो एक आयाम है वह है गर्भ संस्कार आयाम। बीज शुद्धि करना यह एक महत्वपूर्ण अंग है। तो गर्भ संस्कार में बीज संस्कार यह विषय महत्वपूर्ण है। इस विषय पर भी आगे जाकर कुछ व्याख्यान इसमें आयोजित किए जाएंगे। आप सबको विनती है कि आप अवश्य इस व्याख्यानों से लाभान्वित हो। इस विनती के साथ आज का समापन का जो विषय मुझे दिया गया था वो मैं पूर्ण करता हूं। धन्यवाद।
धन्यवाद सर। आपके प्रेरणादायी मार्गदर्शक एवं ज्ञानपूर्व विचार हम सभी के लिए अत्यंत प्रेरक है। आज के इस राष्ट्रीय स्तर के ऑनलाइन व्याख्यानमाला कार्यक्रम को सफल बनाने में प्रत्यक्ष एवं अप्रत्यक्ष रूप से योगदान देने वाले सभी मान्यवरों के प्रति मैं हृदयपूर्वक आभार व्यक्त करती हूँ। सर्वप्रथम आज के उद्घाटक एवं मार्गदर्शक आदरणीय डॉक्टर रविंद्र पाटवतकर सर जी का हार्दिक धन्यवाद। आज के मुख्य वक्ता आदरणीय डॉक्टर दिनेश के सर जी का विशेष आभार, जिन्होंने अपने गहन अध्ययन, अनुभव एवं प्रभावी प्रस्तुतिकरण द्वारा विषय को अत्यंत सरल एवं सारगर्भित रूप से हमारे सामने प्रस्तुत किया। साथ ही कार्यक्रम के मुख्य आदरणीय वैद्य संतोष जी कटने सर जी, डॉक्टर मनोज चौधरी सर जी, आरोग्य भारती पश्चिम महाराष्ट्र प्रांत, भारतीय स्वास्थ्य चिंतन आयाम, भागीरथी मेडिकल फाउंडेशन, सभी आयोजकों, सहभागियों तथा उपस्थित सभी श्रोताओं का मैं मनपूर्वक धन्यवाद करती हूँ। आप सभी के सहयोग, सहभागिता एवं उत्साहपूर्ण उपस्थिति से आज का यह कार्यक्रम सफलतापूर्वक संपन्न हुआ। अब कार्यक्रम के औपचारिक समापन पर हम सभी मिलकर शांति मंत्र का उच्चारण करेंगे। सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्। ओम शांति शांति शांति। धन्यवाद। अब मैं व्याख्यान संपन्न हुआ ऐसे घोषित करती हूँ।